Okay, so as I said, an introduction and explanation of public engagement within SAIL. So this is what I'll be covering today in the slides throughout the presentation. This is a little about me. I support the faculty of medicine in Swansea University and the researchers at Population Data Science and create bespoke public engagement groups under the UK standards for public involvement. I also run the consumer panel, which I'll be showing you later, which was established in 2011 and is core to the Population Data Science Department and SAIL Data Bank users. Also, as part of my role, I create external awareness within the public by linking up with charities and communities and patient groups around Wales and the wider UK, and support the SAIL team attending conferences, seminars, and acting as an advocate for data linkage. So so here are some examples of reasons why you would involve public and patients in your research. So when you would like to discuss proposals for research topics, examining whether the right research questions are being asked, identifying research priorities, advising on how best to engage with the public, offer patient guidance on how to recruit people to study, especially to study steering groups or volunteer to take part. Asking public and patients to comment on developing patient information leaflets or other research materials, and then reviewing information designed for a lay audience. And then here are some examples of how we would engage, or why we'd engage with public patients and in research. So when we're sharing information and knowledge about research and how it's provided and disseminated. Lots of people do this whilst attending science festivals, including debates and discussions on research. Attending open days at a research centre where members of the public are invited to find out more about what we do. And raising awareness of research through media, such as television programmes, newspapers, and I think more specifically, social media. Sharing disseminated findings of a public research study to participants, colleagues, or members of the public. So why is it important? I mean, why do we want to involve members of the public? So it's becoming more increasingly an expectation and usually a requirement now from funders. Public involvement can improve the quality and relevance of your research. Researchers that involve members of the public in research run better studies, and you'll hear a lot about that today. Members of the public have personal knowledge and experience relevant to your research, and therefore provide a more general societal perspective on what you're researching. They have the lived experiences of one or more health conditions or using services. And members of the public also bring experiences of specific communities or groups that we want to engage with. Involving the public, it helps ensure research focuses on outcomes which are important to the public and their community needs. So we like to use the UK standards for public involvement, as this encourages good behaviours and approaches when involving the public. And this is done by offering inclusive and diverse opportunities that are accessible and reach patients, communities and groups the research impacts. Also, it values all contributions, so this builds and sustains trust, respect and productive relationships. Offering and promoting support with opportunities to learn that build confidence and skills for involvement in research. This is important with the public because they like to learn whilst they're getting involved with the research. And where possible, involving the public in your research design, leadership and decision making. Again, we can do this through public groups, PPIE groups or steering groups within the research. Also, using plain lay language for relevant and regular communications, including involvement plans and activities. Again, so important when you want to include public and patients within your research, not to use the jargon that we use in research, especially data linkage. And identifying and sharing the impact, including the difference that the public involvement makes to research design and dissemination. This is so important to making sure that the public can see the whole research cycle and show how their involvement has affected what you have done within the research. So this is our consumer panel, and we were established in 2011. So the consumer panel is sort of feeds into SAIL and all the research that is done within SAIL using SAIL data. So we are currently 22 members, 62% of our group are females, and they're aged between 20 and 75. The group come from all diverse communities and backgrounds, knowledge and life experiences. We feel it's a really important to make sure the group is balanced, and everyone brings a different perspective to the meetings, which is absolutely brilliant. And they all live in rural and urban areas across Wales. So, you know, being able to do these meetings online has enabled us to be able to have a more diverse group across Wales. And they don't now need to travel down to Swansea to be able to get involved. And the same works for the researchers as well, because the meetings are online. It's easier for them to come and present and not actually have to come into Swansea to do the presentations. So the consumer panel meetings, usually they started off quarterly, and this year they've been bi-monthly, as we've had to support dynamic growth of research taking place within SAIL. They take place on the last Wednesday of the month, and they're online between 10 and 3 p.m. The slots are normally up to an hour, and they usually consist of presentations by the researchers, introducing their research or wanting to discuss any sort of ideas that they may have. And then they ask the panel to discuss their ideas, and ask the panel for questions and gain feedback on their research. The panel can be used in a variety of ways. So they can be used for meetings, they can be sent surveys, they can be asked to feedback on information sheets, patient-facing documents, and terms of reference for specific bespoke public engagement groups that you want to create. And they'll also give feedback on PPIE roles, responsibilities, and also feedback or help on drafting funding bids. You can attend the meetings at any time during your research idea, during your interim results, or, which is really nice, on completion to communicate and show disseminated findings of your research. They also can review lay and summaries and publications that you want to put out after your research or during your research cycle. And after the meeting feedback notes are emailed to you afterwards. So researchers that come to the consumer panel have given the following feedback. The meeting and feedback was incredibly helpful in the early stages of research, invaluable at helping me understand from a patient perspective, made me realise the implications on patient care, gave me other ideas and areas I hadn't considered analysing, allowed me to talk to the patients I was trying to help. It was invaluable to listen to their stories and their experiences. And somebody recruited 2 public representatives to be involved in their research. It's all free for SAIL users, which is why people come along to our meetings. And you can engage with the panel throughout the research project cycle. So top tips before we go. It's never too early to involve patients and public in your research ideas. Draft public and PPI plan in application is always a good idea to make sure that the funders know it's a draft, but allow patients and public to inform and shape your PPIE throughout your research cycle. It's important to involve the communities and the charities and the patients that you hope your research is going to impact. And it's also really important to have a dedicated point of contact to make sure regular contact with the group, communities and charities. Public engagement members like to be sort of informed and regular updates of what's going on within the research. So you need to make sure there is somebody that is dedicated for this role. And by doing that, you're investing and developing quality relationships and you're avoiding tokenistic involvement. Always communicate in lay language when involving and engaging with patients and public. And if you need any help, just reach out to discuss with a colleague or specialist public engagement officer. Quite often colleagues have been through experiences and have sort of really good advice to give you. So always a good point to reach out to colleagues.